Welcome back, guys. This is Dr. Christopher Carrubba with TrueLearn, one of the medical directors over here. And I'm bringing you another question today for some USMLE breakdown so we can really show you some of the good test taking skills that you can use to do well on these exams. The question today is coming from our Step 2 and Shelf Bank. And I've highlighted this question because it really shows how you're going to need to use flow algorithms to work through questions on the test. And that could come from medicine, peds, surgery, OB, you name it. There are going to be algorithms that we've got to work through. So let's jump right in. As always, I like starting with the last sentence first and looking at the answer choices just to try to get a feel for where this is going. So we know here we're looking at most appropriate next step in management. This is going to be something that's very sequential. We know that by looking down at these answer choices, we're most likely looking at some form of a trauma question. We've got 24-hour OBS, CT of the abdomen and pelvis, DPL, which, it's there, but we know isn't really going to be a right answer very often. Prescribe analgesics and, a TTE. So maybe there's some chest trauma mixed in there as well. So if you'd like, you can pause the question right now, try to read through this answer and then turn the recording back on, or we can just jump right in and get going with my breakdown. So what we see here is that we have a 19-year-old male, previously healthy, coming into the ED 2 hours after being involved in a fight. During the course of the fight, he fell down, was kicked several times in the left side, punched in the face. Seems like he's not really having a very good day. Now he's got significant pain in the left shoulder, chest, abdomen, so really all over the place at this point. And with this question, I think the first branch point that I would want to look at is really, is the patient hemodynamically stable, and are there signs of frank peritonitis? Maybe with the latter being more important, because if there are signs of frank peritonitis, we know that's going to be a one-way trip to the OR. That being said, we can kind of realize that's not going to be the case here because that was not even an answer choice. And also we see that fast isn't a choice. So we know that we're probably going to end up being a little bit of the ways down in this workup where we're asked to step in and take over. So again, we see that the patient is hemodynamically stable. I think that's a very important takeaway here and is really going to have a high chance of influencing what we do next. We've got a small, non-bleeding laceration, a little bit of bruising, and where we see some issues with are some left-sided chest pain with deep inspiration, but heart and lung sounds are normal. And then the big things that's really jumping out to me is there's tenderness to palpation over the left costal margin and left upper quadrant of the abdomen. And reading these last few details, we've got a normal portable chest x-ray and a bedside ultrasound that's not showing any significant effusions or free fluid. So thinking about where we are right now, I would say we have a patient with blunt chest and abdominal trauma. They are hemodynamically stable. While they are having some rib pain, the chest x-ray is normal, the lung exam is normal. So what's really jumping out to me is more of this left upper quadrant pain that they're having. And what I would be worried about mostly would be that they could potentially have an injury to their spleen that's causing some issue. Now, had we probably stopped right here, the next step would have been to do that fast scan and do that ultrasound to look for the free fluid. But they've already done that. So where we're really asking me is, I have a hemodynamically stable patient with concern for blunt abdominal trauma. They don't have frank peritonitis, so there's no reason to go straight to the OR, but they also have a negative fast scan. So it's really saying, what should I do with that? Answer choices A and D are essentially saying that we're just not very concerned, that we're going to be saying that the ultrasound was good enough. And even though they have a pretty significant injury, pretty significant pain, we're not going to do anything really significant about that. And you shouldn't like that. you should know at this point that FAST is not going to diagnose everything. It wouldn't be able to detect a contained hematoma. It wouldn't be able to detect small bleeding at this point. So that's really not going to be the direction that we would want to go. A and D are just not aggressive enough for finding that injury that could be there. TTE, we've kind of already ruled that out pretty quickly as a junk answer, so we're not going to think too much about that. And we're really down to B and C. And I know I made the joke about DPL never being right, and in reality, it really isn't. But the only place DPL is going to come into play would be if this patient was hemodynamically unstable and had the negative FAST, you could consider doing the DPL to try to look for some bleeding before taking them to the OR. But in this case, it doesn't matter because the patient is stable. They have a really good blood pressure. So this is somebody that I would feel comfortable putting in that CT scanner and really trying to get some more information on. Now, some people would say, why not just take them to the OR and find out? And the reason is a lot of patients with blunt abdominal trauma, even if there is an injury, aren't going to need surgery. So with no signs of frank peritonitis, there's a chance that even if there is a splenic injury or a liver injury present, it's not going to be severe enough to warrant surgery. So obtaining imaging is really the right way to go in this question. So as you do questions like this, get really comfortable with these algorithms and how you're going to use different details to branch one way or another. And I would say if you want to take away one key detail, hemodynamic stability is always going to influence really where that correct answer is and how you want to proceed with that question. So thank you guys. Look forward to doing more with these in the future.